Welcome to the 2021 Annual Membership Meeting of the Turner Syndrome Society of the United States. The purpose of this meeting is to summarize the impact TSSUS has had on the TS community throughout the year, as well as update members on the current state of the society. The good news is the Turner Syndrome Society is solid, and we're looking forward to another impactful year in 2022. I'd like to thank the staff and the board of directors for their dedication and efforts throughout 2021 as well as 2020. It feels as though we're working 3 times harder than usual since we're continuously planning for the best case scenarios, the worst case scenarios, and the most likely scenarios. It probably sounds similar to how you find yourself making your own plans. I also want to thank you for trusting the decisions we've made and sending encouraging words. It really means a lot to us. Our society truly is a collective group of strong individuals who are invested in the well-being of one another. The silver lining to not being able to predict the future is that we found ourselves able to respond to your immediate needs by trying something new or thinking outside the box. Although our strategies changed, our goals remained the same. Advancing knowledge is a priority of TSSUS because ensuring people with TS receive treatments and appropriate intervention is the foundation of good health. After the homepage in 2021, most people accessed the page on the website about the guidelines and checklists, which is a first. Generally, that is not the top page for the year. We updated the doctor directory to include 325 professionals with current information and links to reach them. We had no idea how many times doctors moved from hospital to hospital or changed their information. We also added 10 educational videos to the website or the YouTube channel, and we offered 12 educational webinars. Despite the new and many current resources available online, we had over 2,500 requests requiring personal assistance. We found working remotely allowed us the flexibility to contact people and presenters after hours and on weekends when they are most available. Hosting webinars on weekends and responding to Facebook messages throughout the day serves our community best, and we feel we're learning to balance staff and community needs effectively. The e-newsletters are the primary way we reach the TS community. Feel free to reply back to us with ideas or questions. Another priority of our members ensures Turner syndrome research leads to evidence-based recommendations for TS care. During 2021, the research registry transitioned to a new data collection tool through the University of Texas Health Science Center, where we continue to work closely with the researchers who support patients' rights to managing their own data. And in 2021, we supported the study efforts of 10 researchers. Please consider joining the online registry and participate in the research opportunities overall. It's our best hope for advancing TS physical and mental health. Our final goal encompasses the most satisfying work we do, at least for staff, providing support to individuals and families. Serving as a lifeline and connecting people to information in each other allows us to see the impact we make instantly. We hope you can imagine the relief and peace of mind that people feel when they first reach out to TSSUS and realize people care about their needs and have answers to many of their questions. People constantly say, "I am so glad I called. I can't tell you how much better I feel after talking to you." And we understand personal connections are important, and even more so during the pandemic. Over 3,000 people personally connected with one another through TSSUS during 2021. Many contacted with us directly through social media and received personal encouragement or help. The number one question we receive is, will there be an in-person conference in 2022? And unfortunately, we will not be hosting an in-person conference in 2022. I know it's not a popular decision, and after weeks of contemplation and juggling ideas about how we could minimize the health risks of attendees, it was decided that the only way we could ensure an indoor event 7 months away wouldn't jeopardize someone's health or life was to not have it. We are contemplating other ideas and plan on making 2022 special, especially since it's TSSUS's 35th anniversary. So one thing is for sure, we're all ready to celebrate something positive. And I want to point out that the continued support of our donors allowed us to give out 4 college scholarships and graciously waive fees for services if they were requested. We actively supported the Lymphedema Treatment Act, hoping insurance carriers will provide coverage for compression treatment expenses. And we're supporting a telehealth bill that will allow people with rare conditions to continue to receive telehealth services as they have been over the last year. Our goals and outcomes are tied to the financial position of TSSUS. Over the past 2 years, we've planned for the worst financial situation and reduced our expenses significantly. We've also protected our assets. Our revenues and expenses are significantly different than they were in previous years, mostly because of the significant income and expenses we incur related to the annual conference. We did receive payroll protection program loans in 2020 that were forgiven in 2021. Although the balance sheet reflects the audited financials for 2020, we remain in a solid financial position as we begin 2022. We are cautiously optimistic, yet planning for unwelcome surprises. As mentioned earlier, the leadership of TSSUS has worked exceptionally hard to ensure TSSUS continues to provide services and programs the TS community needs. I hope you're inspired to vote for the next director at large because the full board is inspired by each of you. Imagine the joy TSSUS has brought to the TS community for almost 35 years. Imagine what the future holds. The last 2 years has taught us that change can bring about new opportunities, and we look forward to imagining the future with you. As always, we're here to help, and we do enjoy hearing from you. We will create a Q&A from any questions related to the annual meeting and include it in the January newsletter. I know this was short and sweet this time, and we hope that you have a very happy new year.